So this is a quote from Seema Verma. For data to flow freely, she said, there would have to be an overhaul of meaningful use, and the full ballroom at HIMSS 18 broke into applause. Does that surprise you that they broke into applause at all?
So meaningful use built a really important foundation.
Absolutely. I firmly believe healthcare still would not be digitized if we didn't do MU. So.
And stage one was great. I mean, Dave Blumenthal, John Glasser, and the team put together a good floor. It started to unwind and unravel at about stage two, where then what ended up happening, unfortunately, is that every federal government department decided to make meaningful use its policy lever. Oh, I think we should have implantable devices using universal device identifiers. We should record social determinants of health. We should stamp out Ebola. And every one of those was layered on top of MU. And so what ended up happening is it co-opted the agenda of every healthcare vendor and every provider in America. What should have happened is we should have had, I don't know, stage one and stage one plus, and then stopped. Yeah. And so what we're dealing with now when we talk about stage three is it's just not relevant, right? We're living in a world of machine learning and APIs and clouds, and it's still with, what are the 17 quality measures for diabetics you're going to collect? It's like, oh, stop.
So instead of, so what they say is you're going to see a series of proposed rule changes by the end of the year. Should we just say it's had its day and end it, or should we try to modify it?
So here was my complaint with both stage two and stage three. It in effect said, you must drive a Prius. Well, wait a minute. I have a Volt. No, I have a Tesla. No, it has to be a Prius. Well, is the outcome that you should be able to drive a vehicle with low pollution? Well, then let me buy what I want to buy. If I want to use a skateboard, that's okay too. I'll get some exercise. And that's why we need to scrap the current meaningful use construct. And what we need to say is the outcome is that patients and families are going to have better engagement because we're building tools. But don't tell me what tools.